Hey guys, welcome back to the RT Clinic. I want to show off something today that we started putting here at Union. This is Midline from AngioDynamics with a special bioflow catheter. So you'll notice it is a lot shorter than a PICC line because it is a single lumen, 4 French, about 17 gauge, and this is placed under ultrasound guidance. It's going to go in an area right about here. You're going to see on your patients, you got 3 vessels in this area right here. You have your cephalic, your brachial, and your basilic vessel. It's going to be one of these vessels and actually going to terminate before it gets to their armpit or the axillary. So the beauty about this is it's a solid vascular access and it's not a central line. So the real key is what we're looking for here at Union Hospital and other hospitals is removing central lines if we can when a patient is leaving the ICU and putting in one of these, which is a solid piece of solid access that we can keep for them, but get away from having a central line that could have CLABSIs and all those other issues associated with them. So this is what it looks like. I'll get a little close here. You'll see it's marked Midline multiple times on it, 4 times actually, and it is power injectable. You see that there? And so it will come out about that area right there on your patient. That's what you're expecting. It'll have dressing on it. They'll be changed just like a PICC line. Every 7 days, the CHG dressing changed every 7 days. The respiratory therapists are going to put these in here, which is kind of cool. So we're going to put all the orders in the EMR for you. It needs to be flushed every 12 hours. Turbulent flushing with 10 mL of saline. And also, it'll be cared for a lot like a PICC line. We're going to continue to do CHG bathing every day with these. And we're going to put swab caps on the top of them. And if you have any questions at all, make sure you contact your respiratory therapist. Thanks.
A midline is a peripheral access device placed in the upper arm using the same veins we use for PICC placement. The tip of the catheter, however, terminates below the axillary vein at or below the shoulder. Midlines are FDA approved to dwell up to 29 days. Any medication that can be safely given through a peripheral IV can be given through a midline. Infusions dedicated for central lines should not be given through a midline. Contact pharmacy with specific infusion questions. To distinguish a midline from a PICC, AngioDynamics BioFlow midline is clearly labeled 4 times midline. The BioFlow midline is a 20 centimeter trimmable 4 French catheter with a 17 gauge internal lumen. It is power injectable and will have the infusion max rating on the extension tubing clamp. Proper care and maintenance will help ensure the longevity of the line. Flush with at least 10 milliliters of normal saline using a pulse flush technique. And clamping the line at the end of the last pulse. This creates a turbulent flow to help clean out any residual solutes or blood products left in the line. This will also help create a positive pressure so you do not get blood refluxing back into the end of the catheter. Flushing with at least 10 milliliters of normal saline before and after use, and every 12 hours when not connected to a continuous infusion. The main difference between a PICC line and a midline is where the tip of the catheter terminates. A PICC line terminates in the lower SVC, and a midline terminates in the at or below the axillary vein, so right in the armpit. Dressing changes should be done at 7 days.